If you're looking for the best first trimester pregnancy ball exercises, you're in the right place. My name is Jessica Babich, and I'm a doctor of physical therapy practicing in New York City. In today's video, we are going through my top 3 exercises for people in their first trimester of pregnancy. I'm going to show you exactly how to do these so that you can do them on your own at home when you have the time. Try to do these at least a few times a week to optimize preparation for birth and the changes your body is going to go through. So as a pelvic floor physical therapist, my favorite 3 exercises for women in their first trimester of pregnancy are: number 1, 360 breathing; number 2, pelvic tilts with hip circles; and number 3, bridges. First, let's start with 360 breathing. 360 breathing is a great exercise to try to get your core working automatically again, as our breath is our first part of core training. In pregnancy, we often lose the ability to breathe sideways, backwards, and down into our pelvic floor. So the ball gives some nice feedback to feel for that pelvic floor recoil, and also just have your hands around your rib cage to feel the nice 360 breath. So place your hands around your ribs, and I'm going to have you inhale through your nose, and you should feel your ribs come forward, sides, back, and your breath come down into your pelvic floor. So let's do that together. So as you inhale, you should feel everything open, expand, and lengthen. And as you exhale, everything recoils back to center. And while you're on the ball, you should feel your pelvic floor gently lengthen down into the ball on the inhale, and on the exhale, it slowly recoils. Now let's do a pelvic tilt with hip circles. Pelvic tilts are a great exercise to improve your hip and spine mobility. So sitting on a ball, you can inflate the ball a little bit higher or a little bit lower depending on what's comfortable and what you feel stable with. But for me, I like to have my hips a little bit higher than my knees. So you're going to sit comfortably on the ball, place your hands on your hips, and we're going to arch our back, and then we're going to let it round forward. You're going to arch and let it round forward. So this is a great exercise to do throughout your day to improve, again, those spinal, hip, and pelvic mobility. So instead of just going back and forth, we can also do some circles where you think about trying to move through your pelvis, keeping your upper body still in a circle in the direction of a clock. And you can go in both directions. I often tell my patients that if they're working and sitting is uncomfortable for them, replacing their chair with a stability ball or a pregnancy ball can be really nice so that they can do these movements throughout the day. Finally, let me show you how to do a bridge the proper way. So there's a couple ways to do bridges on the ball, but I really like an elevated bridge because when you're pregnant, sometimes being on the floor doesn't feel great. So if you scoop down on the ball, you just want to make sure that the middle of your back is supported and that your feet are firmly planted in front of you. From here, we're going to inhale to prepare, and then exhale, you want to push through your feet, lifting up through your glutes. And you should feel your glutes working here. You shouldn't feel your back. So again, we're going to inhale, and then exhale on the effort, thinking about our thigh bones shooting over our feet, and then come down. So there's lots of variations you can do here. You can continue to do the motion up and down, or you can lift up and simply hold a bridge. And that will also get some sustained glute activation. Remember to save this video so you can repeat first trimester exercises a few times a week. And once you are in your second trimester, I have a video for that, as well as the third trimester. If this video helped you to feel informed, confident, or more hopeful, hit the like and subscribe, and share this with someone who is on the same journey too. If you have any questions, be sure to drop them in the comments below, and I will do my best to answer them in future videos. And if you live in New York City and would like personalized guidance, you can work with me either in person or virtually. I'm Dr. Jessica, and I'll see you in the next video.